and president of its Hospital and Community Services Division. She previously served hospitals in Baltimore and New York City. Prior to starting her career, she earned her Bachelor of Arts in Economics in Germany at Duke University. So I'm learning we're fellow Duke alums, but as you can tell by looking at it, we did not overlap. She then earned a Master in Administrative Science and Management from Johns Hopkins University. Currently lives as a member of the Women's Forum of Colorado and the Colorado Forum, board member of Primera Blue Cross, and was named, very importantly, in 2018 as an outstanding woman in business by the Denver Business Journal. Under her leadership, UCHealth now includes 12 Colorado hospitals with about 2,000 inpatient beds and more than 150 clinics in Colorado, southern Wyoming, and western Nebraska. Her leadership is focused on strategic partnerships, expansion of the system's footprint in the region, developing new models of care, as well as improving patient access and experience, and also supporting the academic mission. She is stressing that UCHealth foster new innovations and technologies, support the care of each and every individual patient, and improve overall health in our population. Today, her talk is entitled UCHealth and its commitment to improving lives throughout Colorado. And she will give us, during this talk, I believe, an overview of UCHealth and its commitment to improving lives, sharing how UCHealth is advancing medicine through research and innovation, but very importantly, she will also discuss some of the major challenges facing us in the healthcare industry today. Liz?
Thank you. That was quite an introduction. I appreciate the opportunity. Is this working? I appreciate the opportunity to be here today, and as Dr. Grover said, I just want to share with you a little bit about what we are doing at UCHealth and how we are focused on the state of Colorado. So for starters, as many of you know, we are a Colorado-based organization, but we are a separate institution and a separate 501c3 nonprofit organization from the university. While we are very tightly aligned, we are not one organization. And as you heard, we are 12 hospitals, and our flagship hospital is the University of Colorado Hospital on the Anschutz Medical Campus. We see about 30% of the population of Colorado, something that we are very proud of, and we are very focused on making sure that we address and make ourselves accessible to all of the people that live in Colorado. We have about 24,000 employees, and as we have grown, and as Colorado grows, we see more and more individuals wanting to come to the university health system for their care. In fact, 498 new patients come to us each and every day. Those are patients who have never, ever experienced our care before. So we are a growing, vibrant organization whose sole mission is to improve the lives of the residents of Colorado and beyond. And so I like the teaser that Fred Lawrence gave. We focus every single day on how can we make sure that we treat our patients so that they can go on and lead their extraordinary lives and improve their lives. We also view our role in the community as something that is very important. We believe that we are an asset in the community, and that we see people from every corner, every zip code within the state of Colorado. In fact, almost 100%, 99.9. I, of course, had to ask my marketing and strategic planning person, what is the 0.1%? It is a small community called Bedford, Colorado, which is on the western slope, and it has a population of about 93. So we just haven't treated anyone from that specific region. But we do see, as I said, patients throughout the state, and we transfer a lot of patients, not just from Colorado, but also from the surrounding states, into our main facilities. In fact, almost 12,000 a year. So from a resource perspective, we really view it as our obligation that when patients get sick and they're in hospitals that may be rural and not have the specialty services that we do, we just say yes. We make sure that we accept anyone that needs to come to our facilities. We're the only comprehensive transplant center in the region, and we are the main teaching partner for the School of Medicine. 50% of the physicians that practice in Colorado are trained in Colorado, and so most of them train at our facilities. So again, there's only one medical school in the state of Colorado. As I said, I think it's important that we recognize that not everybody can afford care, and so we have commercial insurance, Medicare, care for the elderly, as you all know, and Medicaid for those patients that can't afford their own insurance. We are the largest Medicaid provider in the state. We see we're almost a quarter of all the Medicaid patients across all of our hospitals. We feel very strongly that patients, individuals, residents deserve to see and have the care that they need. So we make sure that we treat all comers, and that's part of our mission, and we will continue to do that. And why I focus on this is because neither Medicare nor Medicaid cover the cost of care that it actually costs to treat patients. So we need to make sure that we see enough commercial patients so that we can continue to see these Medicaid and Medicare patients. And as we have all the challenges with regard to the cost of health care, unfortunately, less and less organizations, physicians, and health systems are seeing Medicaid patients. I just wanted to spend a few moments now sharing with you what we really focus on each and every day and what the focus is of UCHealth. As I said, we really work to improve and innovate the ways that we care for our patients so that we can make sure they go on to lead those extraordinary lives and focus on our mission of improving lives. So what does that mean, and how do we actually do that? Well, one thing that we do is we focus relentlessly on quality. And if you look across all of our hospitals, and those hospitals that aren't listed are because we've opened a couple of new ones, specifically one in Greeley and one in Highlands Ranch, and we don't have enough data on them to be up here, but all of our other ones are. We focus on making sure that we provide excellent quality care, which means we benchmark ourselves against all the thousands of hospitals nationally with the goal of always being in the top 10%. And why is it important to be in the top 10%? The reason it's so important to be one of the best quality hospitals in the country is because it means that your patients are having better outcomes. It means that you have a better chance of survival if you go to a hospital that has better quality outcomes than one that has not such great quality outcomes. So if you just compare being at the 90th percentile versus the 50th percentile for our patient, the number of patients we see, it's over 150 more patients that are surviving than would be expected to survive. So we never lose focus on the fact that our quality outcomes are a differentiator, and that's what we're here to do, to make sure that patients come in and have great outcomes so they can go on, as we say, and lead their extraordinary lives. We also recognize that healthcare cost is a huge challenge, and we need to be part of the solution. So we focus very much on how do we actually reduce the cost of healthcare. So all of the new facilities that we have expanded and opened have been at a lower price point. We also have been very focused on having facilities outpatient in an ambulatory environment that is less expensive and more accessible to our patients. The new hospitals that we've opened are less expensive. We also want to make sure that no one is ever surprised with the cost of their health care. So we've actually, have any of you been to UCHealth? Any of our facilities? So we have an app. I don't know if any of you have been on it to schedule appointments and to get information. On that app, you actually can look at the cost of a procedure, and we actually hit it up against your exact insurance so that you can know with your deductible how much a service will actually cost you, because the last thing we want is for you to be surprised when you come to see us for care. We also are very focused on, when you look at the cost of care, how can we prevent someone from coming to an emergency room, or what can we do from a preventative perspective to avoid the more expensive care that they have. So we're very focused on managing across the population and seeing what we can do to reduce the cost of health care. this is something that's going to be a focus for our entire lives because we recognize it's a real challenge. We also recognize that there is a behavioral health crisis in the country, and there certainly is one in the state. So to that end, this year we have announced a $100 million commitment to behavioral health. We also have initiated a $25 million dollar-for-dollar match, so I heard you were asking for support for your Rotary goals. We also have goals, so if we've committed as an organization $100 million, and if anyone wants to match the $25 million, I'm happy to talk to any of you afterwards, but any little bit helps. So I smile about it, but behavioral health is a huge issue. And so 3 of the areas that we are committed to focusing on to improve the health of the residents of Colorado are to integrate behavioral health in primary care. The thought that behavioral health has made a lot of improvements with regard to the stigma of behavioral health, but it's still out there. And if you can embed licensed social workers, psychologists, and psychiatrists in all of your primary care offices and address patients' needs embedded in the physician's offices, we think we can make great strides in addressing issues early on, addressing the stigma, and also making sure that patients that have been identified as needing some support will have access to that support. So we're looking in the next 5 years to have these services in every one of our primary care offices. If we do that calculation with regard to if each behavioral health therapist in a primary care office sees minimally, which is pretty conservative, 5 patients a day, we'll be providing an incremental 70,000 behavioral health visits a day in a year, with the concept of early intervention can prevent significant issues in the future. So that's one area where we are investing, and another is in virtual telebehavioral health services. As you all know, Colorado has a lot of rural areas. There are many communities in Colorado that don't even have one psychiatrist, where patients come to an emergency room in a small rural hospital and they don't have the access for emergency psychiatric services to assess what the right treatment should be. We are launching a virtual health service to provide those services to all of those organizations and facilities that do not have those services. Likewise, we also know that emergency services is step 1, and the next phase then would be providing virtual services in areas that it's hard for patients to access. And then lastly, our $100 million commitment, and again, this is in addition to the services that we provide today, is to build an inpatient behavioral health unit on the Anschutz campus for those patients that have medical and behavioral health issues that are very hard to find treatment and to place. So that's one of the areas that we've been focusing on. We also are very proud to be a leader, unfortunately, in addressing some of the opioid epidemic issues that we have. So again, when you look at the challenges we have across the country and within the state, we want to be on the forefront of preventing addicts, treating addicts, and helping make sure that we can help get those addicts that already are out there the treatment that they need. So when we say preventing addicts, for those of you who raised your hands and you were in our hospitals, you probably saw these signs on all of our elevators and in our hallways, because we think it's very important for our patients to be empowered to have healthy conversations about opioids with their clinicians. So if they're coming in for a visit to schedule their surgery, we want to make sure that they're comfortable asking their clinician, do I have to be on an opioid? What are the opioids? Do you even know that these various drugs, tramadol, etc., are opioids? And can you ask if there are other options? So we want to engage our patients so that they ask for alternatives. Again, if you can prevent anyone from becoming an addict as a result of taking an opioid, that's the first step in prevention, obviously. Secondly, we know when we do have addicts that come to us, we want to make sure that we can treat them. We've got lots of different programs in place to treat them immediately in our emergency room, but also to get them into treatment afterwards. And then we've also established limits within our medical record system on the number of opioids that anyone can prescribe. Because again, if you never get a prescription for 30 opioids, the chances of you becoming addicted are significantly less. So as an organization, we're focused on behavioral health fight as well as reducing the opioid dependency in the country. So we look as an organization, as I said, we focus on making sure we take care of patients each and every day from a quality perspective, addressing the entire patient behavioral health and some of the opioid pieces. But we're also very focused on innovating how we provide health care. And when we talk about the innovation of medicine, we talk about it two different ways. One is developing the medical advancements that actually cure patients or treat them or help them. And the other is improving operations through new tools and technologies. And so when we look at the medical advances for our patients, again, you heard today from Mr. Lawrence about the success on some of the cancer trials on the hepatitis C. It's academic medical centers across the country who have been on the forefront of medical breakthroughs. That's where organ transplantation was developed. That's where the polio vaccine was discovered. That's where the cure for hepatitis C has been made. All of these advances have happened in academic medical centers. And when you look at the cancer treatments that are out there, the most advanced cancer centers, 98% of the National Cancer Institute's comprehensive cancer centers are all embedded within academic medical centers, with the goal of providing advanced treatment and being on the forefront of providing new and emerging treatments for care. And in fact, if you look at this graph here, I think it's pretty remarkable to see. Just 60 years is a very long time, I recognize that, but there's been a 75% decline in the deaths from cardiovascular disease per 100,000 population. So the chances of living and having a great outcome and surviving today versus 60 years ago is phenomenal. And those are advances that were all made in an academic medical center. And I focus on that because academic medical centers need support and are more expensive and always will be more expensive than community hospitals. And the School of Medicine here, the University of Colorado School of Medicine, only gets about $24 million worth of support and funding from the state, one of the lowest supports from states across the country. So they look at systems like UCHealth to help support them. And if you look at some of the amazing things that have happened at the School of Medicine, how many of you knew that the shingles vaccine was developed here in Colorado at the School of Medicine? So the shingles vaccine was actually developed here. And the School of Medicine was also very, very important in the role in the evaluation of the cure for finding the cure of hepatitis C, and also was the first hospital in the region to perform the bionic eye procedure. This bionic eye procedure is just one example. It's actually a woman who was blind and brought as a result of the advanced technology and the trials that are going on at UCHealth in conjunction with the School of Medicine, she can now see again. These are the types of advances that academic medical centers do each and every day, but also that happen here at the School of Medicine. We have an amazing video of when this procedure was done for this woman and she saw for the first time. And the first thing she saw was her son in front of her. So it was really, if you think about a life-changing experience and getting your independence back and what you can do when you can see, and translate that also into the cost of care. If you can now go on and try to be more independent and live in a different manner, can reduce the cost of care as well. The other component of the advancement of science across the sort of the country and what's happening here in Colorado, we at UCHealth are investing in personalized medicine. I don't know how many of you have heard about personalized medicine, but what we actually are doing is we have a biobank that actually we to the specific detail have your genome and your genetic makeup and bio and your specific information. So what does that mean? It means for very specific, and again this becomes more and more advanced each year, but for specific diseases and diagnosis, we now can determine that if I have bladder cancer, for example, and my colleague Dan Weaver has bladder cancer, depending on our specific genetic makeup, we will get a different drug regimen because they have the technology now to determine and figure out who and what they need to give us to better respond to a treatment. So when you look at why are the survival rates for cancer improving and what are these clinical trials that are going on, these are examples of actual treatments that are happening today where we actually design the treatment specific to your personal genome. We also continue to invest in cancer because, as you can see, the outcomes here at the University of Colorado have been phenomenal in that if you come to us for care, you can see your survival rates are again better than the national average. So as a system that is relentlessly focused on improving the lives of our patients, we focus on how do we actually make sure we drive outcomes. So we are nonprofit. The margins that we make, we invest right back into the research and the talented individuals that we work with each and every day because the grants and the funding just isn't there to pay for all of the support that they need. So switching for a moment so those are the medical advances that we partner with the scientists and clinicians on. We also focus very much on how do we actually deliver care in a more efficient manner. I think you would all agree that when you look at retail or Amazon or experiences in other industries, banking or whatever, they're far better than the experiences that you necessarily have in healthcare, and that we're very behind the times in how we address the patient's experience, customer's experience, and how we actually care for everyone. We've still been very much a bricks and mortar organization when everything else has gone electronically. So one of the areas that we have spent a great deal of time focusing on the last couple of years is creating a virtual health center. And that virtual health center's goal is to take care of the little sick to the sickest of sick. So we have a virtual urgent care center now, so you can go online, and for $49.99, you can go online. It asks you a bunch of questions, whether you have, for what your main complaint is, meaning pink eye or infection or whatever, and you can actually virtually see a nurse practitioner or a physician staffed by emergency physicians and get your antibiotic and treatment right then again virtually. We also recognize that as we look at people that are spread out across Colorado, and especially with the traffic as it is today, if you're at, for example, our Longs Peak Hospital, you don't necessarily, if you get sicker and you need to have intensive care treatment by a specialist, you don't always want to have to be transferred to the Anschutz campus. So we actually have our intensive care physicians monitoring remotely our patients in Longs Peak, so they're getting the exact same care as they would be getting at the higher acuity hospital without having to be transferred, so they can stay close to home at a lower cost. And that we can do because we monitor, and all of our equipment and all of our information systems are all integrated. We also use advanced data analytics to determine the millions of pieces of data that are coming in on all of our patients every day. Who is at risk for potentially having an event, specific events, for example, sepsis, which is an infection that has a very, very high mortality rate. We have sophisticated algorithms that literally scans all of our patients that are in the hospital to say, we notice these 3 variables have happened. Your temperature went up or something happened. And then we have a physician with a team of nurses that then hone in on that patient and call the clinician that's at the bedside and say, we're worried about this specific patient. So these are the types of things that we can do in our virtual health center. We also have a lot of patients that have various dementia issues, and they need one-on-one sitters. Again, a very costly solution. We now have cameras in our patient rooms, so we have remote sitters looking at those patients that are constantly talking to them if they get up to see if they need something. So when you look at the future of where healthcare is going, the virtual landscape is going to have a big, big impact. Another area that we're very focused on are these wearable devices. This is an actual device. costs about $30. And we can track all of these metrics that you see on the screen here. We've just gotten FDA approval in the last month with this company called BioIntelliSense, with the goal of, if you can monitor people at home, they don't need to be in the hospital. So if you just think about where we're going with this, and again, the cost and quality implications. So you're in the hospital, you've just had surgery, we want to keep you for 2 more days to monitor and make sure everything's fine. We don't need to keep you in the hospital anymore. We can send you home and monitor you remotely. Or if you're going to have valve replacement surgery and we want to make sure that we ask you, have you had a fever in the last couple of days or 2 weeks specifically? Patients tell us no, they haven't. Now, when our surgeons see the patient, we can say, can you put this monitor on? And we'll monitor you and we'll be able to tell whether you actually have had a fever in the last 2 weeks. Because if you had a fever in the last 2 weeks, the chances of getting an infection with a valve replacement go up. So these are the types of things that we will be able to do. And it's actually the CEO of this company, who is a former cardiac surgeon, was just actually called by the CDC to say, since you can monitor temperature and cough, could you monitor patients for the coronavirus? And so if you think about, what do you want to do? You want to isolate people that are infected. So if you can remotely monitor a patient. Now again, we don't have the algorithms to say for the coronavirus, for example, but if you're trying to monitor 1 million people, you gave 1 million people these wearables, and you had the algorithms to be able to say, just tell me the patients that coughed and had a fever, and you can sort out 95% of the population, and then you check on those 5%, the implications are significant. So as an organization, we are very focused on how we can use wearables to help advance the treatment of care and also keep patients out of the hospital and back in the homes where they want to. When someone has joint replacement surgery, we want to make sure they're walking as soon as they're done with the surgery and they're walking at home. We can monitor this. So lots of great implications. So when you look at the future of medicine, I think it's incredibly bright. We've got amazing scientists that are coming up with new treatments. We also have amazing technology that can help us improve the way that we care for patients. So when you also think about all the questions that a physician or a nurse asks you when you go to a hospital or an office visit, we'll be able to say, okay, let us download a lot of this information. We won't just have to ask you your memory, because actually what you tell us is not always what is actually happening, even though you have the best intentions of telling us how much you're walking or what your heart rate or respiratory rate has been. So moving along, while I think the future is great, we certainly have some risks and challenges as an industry. The political and regulatory uncertainty, both the state, particularly in this state, are significant, and it is a major topic conversation every day with the politicians, with front page always on the Wall Street Journal. So healthcare is in the line of fire, and so constantly being challenged. We also have a lot of disruption. We've seen a lot of integration, for example, with insurance companies and pharmacies, and a lot of other organizations coming in to disrupt healthcare as we traditionally know it. I actually think the disruption is great because we haven't met the needs of the patients and the consumers, so if it forces us all to get better, it's exactly what we should be doing. I do think the political and regulatory landscape is the biggest challenge we have here in Colorado. You've probably heard a lot about the public option that the governor is proposing. We agree with the governor that the cost of insurance and the premiums and the cost of healthcare absolutely have to come down, but just for grounding, we have the 9th lowest insurance premiums in the country, and they're inflating at a rate that's the 2nd lowest in the country. That's not to say we do not have a healthcare problem, cost problem, we do, but our starting point is isn't so bad. And so the challenge that we have is the proposal to implement a public option which would set rates on hospitals, whereas we as an organization believe that we should be looking at the total cost of care and how do we reduce the total cost of care which would then reduce the premiums for everyone in the room. So we're very focused on how do we actually do that. We're hoping to be able to work with the legislators and the administration to see how we actually can collectively work to reduce that cost of care. So quickly, I hope I gave you a little bit of a flavor about some of the things that we're doing at UCHealth, but if there are 4 things I'd like you to just take away from today, one is, as an organization, UCHealth is Colorado-based. We are absolutely committed to Colorado and always will be. We are very focused on improving the lives of our patients. We want our patients to go on and lead those extraordinary lives that they do, and we can only let them do that if we're focused on always making them better. We're focused on reducing the cost of care, and we're very focused on defining the future of medicine and how medicine will actually look tomorrow, in the next year, and the years after that. So that, in a quick nutshell, is a little bit about UCHealth, and I'm happy to answer any questions that any of you may have.
All right, so I'm going to cheat a little bit and give you a quick, she did not pay me for this. I had a kidney stone in November. It was actually a smaller, larger boulder. I went to their wonderful facility in Highlands Ranch, and I got to tell you, some of the best care I've ever had. And here's the app on the phone if you want to see it.
Thank you.
Thanks.
Appreciate that.
Liz, thanks for being here today. This was great. It's great to learn more about UCHealth. One of the things that I was very interested in is when you said there was transparency in your fees. That seems to be something that's really been lacking in our medical system. And how do you see that? Why isn't that going on across the board? If we don't know how much our care is costing, how can we be consumers and make decisions and help the cost of care be managed in some way? It seems like it's an easy solution, but why is it not being implemented in other areas?
So specifically, I think there's been legislation, certainly in this state and other places, that have been passed with regard to posting the cost of care. But since you actually, and none of us actually pay what the cost is that's listed, it doesn't address the issue, because what really everyone wants to know is, how much does it cost me? So I want to know how much I, as an individual, are going to pay for my hip replacement or my MRI. And so the challenge has been that everyone has a different rate, and depending on their insurance plan. So we actually are the first system in the country, and we've been recognized by CMA at CMS. We had the sophisticated technology to be able to say, if we know who you are and you then say, I'm going to have a hip replacement, we can hit up live against your database. I mean, your insurance company. So for you, that number could be different in January when you haven't hit your deductible versus what it would be in July. So the reason that I think it's been very challenging is because everyone has a different contract and everyone's got a different benefit design plan. So we could give you an answer, but if you would hit your deductible in July, we're giving you a number that might have been different when you hadn't hit it in January. There's still a lot of improvement that can be made, but we, at least as an organization, when we have your information, if you've been with us, we automatically have your information and we'll hit it. If not, there's an opportunity to enter it. But the main reason is because everybody has a different benefit design plan that makes it so hard to be able to give the individual what the cost will be to them.
Do we have time for one more? We're going to take one here.
Liz, thanks for being here. There's a group, primarily Metro Denver Rotarians, with a couple of clubs further out, Rotarians for mental health, and we're really advocating for education. My question to you is about your behavioral health inpatient. Tell us a little bit more about what you're planning.
Sure. So what we're planning on the Anschutz campus is we have many patients that come to us for behavioral health issues that also have significant medical issues. And so the question then becomes, what is the primary diagnosis here? Is it a medical issue and they should be on a medical floor, or is it a behavioral health issue and they need medical help in addition? So when you're looking to place those patients, it's always hard to place behavioral health patients, but it's really difficult to place behavioral health patients that have significant medical issues. But when the medical issue is secondary, meaning they should not be on a medical floor, the first issue that needs to be addressed is their behavioral health specific acute diagnosis. So what we're planning on doing in that campus is having a unit that addresses behavioral health first. It'll be a licensed behavioral health unit, but has the ability to take care of complex medical patients simultaneously. And those patients are virtually impossible to place. So to really address a void that exists today in the continuum of care.
Thank you, Liz. That was a great story about what UCHealth is doing for us here. It's vitally important to Colorado to have the resources that we do, to live extraordinary and to be extraordinary and to be able to, and to be healthy. And Liz, thank you for leaving Pittsburgh, Baltimore, back to the Mid-Atlantic and coming out to Colorado to lead this system. It's great to have you here. Thank you for taking time to be with us.
And we're here if you need us. We hope you don't, but we're here if you need us.
One other thing. Well, you mentioned polio, and I don't know if maybe it was mentioned to you perhaps before being at Rotary, but you might know that Rotary has been intimately involved in the polio fight around the world. In honor of your being here today, together with the Bill and Melinda Gates Foundation, a donation has been made to give that polio vaccine to 100 children. So thank you for being here today. So